Hi, my name is Lady Pimentel, Patient Navigator in Advanced Care Planning. I will work close to you to outreach, scheduling, and educate patients and family in advanced care planning. I will make sure that the forms are completed in EPIC and in EMR. I will help connect the patient what they need and resources that we have in the health center and outside the health center. You can contact me via EPIC and Basket. Thank you.
On the next video, you will notice a woman experienced an end-of-life care, which communication or the absence of the communication play a role on her experience in end-of-life care.
My stepdad's really the man who raised me. He and my mom got married when I was pretty young. I remember him as a very fiery guy. He was very passionate about everything. My stepdad got sick in the fall of my junior year of college, and he had bladder cancer that they found in his kidney. So my stepfather was really aggressive in treatment, early on, and he and my mom were really optimistic, but there did reach a point where it was clear the chemo wasn't working, and that ultimately this would be the thing that we lost him to. And I think he had very specific conversations with his doctor. His doctor seemed to be really tuned in with what he wanted. My mom also took it upon herself, though, to start those conversations with him. So my mom had to kind of make it okay and would say things like, let me tell you what I want if I go first. And then he would say, okay, well, if I go first. So she kind of had to make it okay for him. Ultimately, in the final couple of days, he did end up in the hospital. But we were all there, and we were able to say our goodbyes, and he wasn't in any pain. And we were ready in a way. About 8 months after he passed away, my dad got cancer, and he had lung cancer. And my dad was a very different person than my stepdad, and very private, and would never want to burden other people with what he's going through. So I remember staying with him for 2 days and being like, oh my gosh, he's getting really sick and there's no plan. He was heavily medicated and was still driving himself around. Not safe. He was still working. He also lived in an apartment that had lots of stairs and was growing really weak. I went to a number of his doctor's visits with him, and the doctor knew that he lived alone and knew that he was getting weaker, but that was never a part of the conversation of we talked about the chemo and we talked about the radiation, but we never talked about how are you getting to these doctor's appointments? How are you getting in your apartment? Towards the end of his life, he was in incredible pain. And so we rushed him to the emergency room, and his pain was so bad that they had to give him so much morphine to get over that hump that within 30 minutes he was out. And so there was really no time to say goodbye. What I wish his doctor had understood, and that I wish my dad had understood, but especially his doctors, that the cancer was only a small part of what was actually happening in our lives. We weren't talking about what my dad valued and what a good day looked like for him. My dad's experience is like nothing anyone should ever experience. He deserved much better than that. With my stepfather, there was always open dialogue about what was happening, and everyone knew where everyone stood. And most importantly, we knew where Jerry stood. My stepdad's death was honestly pretty awesome. And I know that's a weird thing to say, but it was beautiful. And I feel really privileged to be able to have taken care of him. It's a wonderful thing to take care of somebody who's taking care of you. I want everyone to have the experience that my stepfather had, and to essentially have the care that they want, and to feel like they're in control of that experience.
What is serious illness conversation? Serious illness conversation describe conversation between clinicians and their patients and families about the expected courses of serious illness of the goal, values and priority that conform and treatment decision. Serious illness communication is a type of advanced care planning. It might result in decisions about future use life-sustaining treatment, but there are no priority focus of a serious illness conversation. Rather, it aims to prepare patients and family for a certain future.
Set up for serious illness conversation. Review the patient medical history before you see them to create the right setting. Make sure that you have tissue, a chair for the patient and the family member to sit comfortably. 3. Asset understanding. Ask questions as, what is your understanding for your illness? 4. Share information. Share the information, what you noticed or what you know about the medical history. 5. Use silence. Pay attention to the emotion of the moment. That's the right moment that is good to share your information and to allow silence to happen. 6. Ask questions. Explore values, goals, and the treatment preference. 7. Recommend medical care. Depends on the patient's wishes and goals. You can recommend the medical care that is best for your patient. 8. Translate the goals into care plan. That will help you to make the right decision for the patient. 9. Summary and follow-up. Do a summary of the conversation that you had with the patient, kind of like active listening and repeating back what the patient told you already, and do the correct follow-up in the end. Sometimes the serious illness conversation happen more than once. Depends on the patient's medical condition. On the next video, you will notice a provider using the serious illness conversation. Pay attention on the setup, share information, ask questions, recommendation, translate goals, care plan, and summary and follow-up.
Mr. Jackson will be seeing Dr. Fromey, his primary care physician. Today, Dr. Fromey has planned to have a serious illness conversation with Mr. Jackson. Mr. Jackson was informed in advance that part of the focus of this visit would be to talk about Mr. Jackson's goals and priorities. Dr. Fromey's goals for this conversation are to ensure that Mr. Jackson understands what may be ahead in the setting of his existing medical conditions, and to explore Mr. Jackson's goals, values, and preferences for care in the future. To do so, he's going to use the Serious Illness Conversation Guide. Let's take a look at Dr. Fromey's conversation with Mr. Jackson.
Hi, Mr. Jackson. It's good to see you virtually like this.
Yeah.
How are you feeling?
Hi. I've been better, but I'm feeling good. If you know, I'm out of hospital, and so that's good.
Yeah.
So overall, I'm doing all right.
Amen. Well, and then how was it being in the hospital this last time?
I didn't like it. I just didn't like being there. People are fine, doctors, nurses.
Yeah.
But I'm not complaining too much.
That's fair. Well, listen, I'd like to talk about what is ahead with your illness and have us do some thinking in advance about what's important to you so that I can make sure that we provide you with the care you want. Would that be okay?
Oh my, let's see. Could we maybe wait on that a little? Maybe a little later. Okay.
We could. I would like to talk about it today. I am trying to do this with all my patients, and I like to try to do it at a time when they're actually feeling better. And because it's hard to have these conversations, when you're feeling really sick.
Right. That makes sense. Okay.
All right. Thanks. Well, so my first question is what is your understanding now of where you are with your illness?
Well, I have bad lungs, and they're not going to get better. I just hope they stay the same, maybe. But that's what I got. I got bad lungs.
Yeah, fair enough. Well, how much information about what is likely to be ahead with your illness would you like from me?
Everything. Yeah.
Okay.
Yeah.
Well, then I want to share with you my understanding of where things are with your illness. I'll say it can be difficult to predict what's going to happen with lung disease. I hope that you will continue to live well for a long time. Like, that's the goal. But I'm also worried that you could get really sick really quickly. And I think it's important to prepare for that possibility.
Oh man, you mean like you're talking about if if it gets worse and stuff, huh?
Yeah.
Oh, brother. Wow.
You know, this is hard to think about and hard to talk about it.
Yeah. But we got to do what we got to do.
Right.
We got to talk about it. So okay, I'm game.
All right. Well, I appreciate that. What are your most important goals if your health situation worsens?
What do you mean? Like,
Well, for example, for some people, their work is their most important thing.
oh yeah. My family.
Mm-hmm.
My family.
Yep.
If I had to say, I guess number one goal, see my grandson graduate from high school. He's supposed to graduate next year.
Oh, that's wonderful.
Yeah.
Wow. That's
He's a
huge.
good boy. Yeah. He's a good boy.
Yeah. Yes. So that's exactly what I'm looking for. Well, and then what are your biggest fears and worries about the future with your health?
Having my wife see me suffer. I've been thinking about that a lot.
Mm.
And I'm not looking forward to suffocating.
All right.
Yeah.
That's fair.
Yeah.
Actually, it's great you still have your sense of humor. I would like to come back to that subject later, because I think there's a lot of things that we can do to put a plan in place to really help prevent you from feeling like you're suffocating. But
Okay.
Do you mind if we kind of finish this line of questions first?
Sure, that's fine.
Okay, great. What gives you strength as you think about the future with your illness?
I look to God as I lead my life. I'm not a big churcher, but I do look to God, and that helps me.
Yeah, that's wonderful. Well, and then what abilities are so critical to your life that you can't imagine living without them?
Like what?
Well, a mentor of mine, her father told her that as long as he could sit in his easy chair, watch football on TV, and eat chocolate ice cream, then he was good.
Excuse me. Yeah, I like that. That's funny. Yeah, I see what you're saying. I would like to be able to take care of myself. I mean, physically take care of myself,
Yeah.
by myself, like a bathroom and wash myself and stuff. That's a big thing for me.
Yeah, that makes sense.
Yeah.
Well, if you became sicker, how much are you willing to go through for the possibility of gaining more time?
Oh, you mean like what kind of medical stuff I would be willing to?
Yeah, for
Yeah.
example.
Yeah, right. Well, that's a tough one, because a couple of times ago, as you know, I was in the ICU, and I don't know that I want to go through that again. But at the same time, I got out of it, so I'm not sure. That's a tough one to answer.
Yeah. Well, actually, just me hearing that you've had that experience and you're a little bit on the fence now is really helpful. I don't think we have to make a decision about that today, but it's really helpful for me to know that about you.
Okay, good.
How much does your family know about your priorities and wishes, the stuff we've been talking about?
That's a good question. I've tried not to, upset my wife, and even my kids. They're adults, they're all, but I don't want them to worry too much, so I haven't really talked about it with them. Yeah.
Well, Let me see, let me try and summarize what I heard you say, and you can correct me if I get something not quite right. But what I heard you say was really the important things for you are your family, seeing your grandson graduate from high school, not seeing your wife see you suffer, that it's important for you to feel like you can take care of yourself physically, and that you've had this experience of being in the ICU and are not decided yet maybe about whether you'd want to go through that again.
Yeah.
I think keeping all that in mind and what we know about your illness, I'd recommend that we have another one of these conversations and maybe bring your wife into the loop. What I'm thinking is one way that we can make this easier for her and both of you is really to have her hear kind of what's important to you and what the plan is so that when things happen, she doesn't panic. And I think that'll really help us make sure that your treatment plans reflect what is important to you also.
Mm.
How does that plan seem to you?
You know, that makes sense to me, doctor. I think it might help her. 'Cause I think she would like that.
Good, good. I'm glad to hear that.
Yeah.
And I want you to know I'll do everything I can to help you through this.
Thank you. I appreciate that.
Yeah, you're welcome. So I'd like to come back to the